Hello, everyone. Sorry about the late start there. Had a little technical difficulties, but so excited for you all to be here tonight as we talk about some ergonomics. So, first off, I just want to give a shout out to Midmark. They are sponsoring this webinar. They've got some really great innovative products that we're going to talk about a little bit later, all centered around ergonomics, which is something that they and myself take very seriously. But before we get started, I want to share something that I think is kind of funny with you and probably relatable to you. One of my hobbies is baking. I think it's very important for us in dentistry to have hobbies that we can just kind of check out and focus on something else. But this is something I've really enjoyed kind of teaching myself over the last year or so. But I recently moved into a new house. And if you're anything like me, you probably start off your move thinking you're going to be super organized and have everything nice and neat in your new place. But moving is exhausting. And pretty soon you just start throwing things into empty cabinets, right? Like wherever you have room, you're going to put your stuff instead of really thinking of how you're going to strategically place these things. So that's exactly what happened to me. And once I started baking, I realized something that I wasn't setting myself up for success in my kitchen. I was reaching up really high for things, down low on my hands and knees into these lower cabinets. And it reminded me of what we see in the operatory. I realized that I wasn't setting myself up for success, just like what we do in the op. We kind of just put things wherever. We don't put a whole lot of thought into that. And then we start to reach and twist and hunch to reach our stuff, right? So I had to kind of take a step back, take everything out of the cabinets and reorganize things so that the things that I used most frequently were in a more convenient spot for me. And then things maybe I didn't use so much, I could put the up in those higher cabinets or down in the lower ones. But when we think about how we get injured in dentistry, it's because of these really small things like reaching and twisting, just like what you see in the picture here in the operatory. It's these small movements over time that really add up and start to hurt us. But another thing I noticed is, please don't judge me, I'm a very messy baker. I use a million things depending on what I'm doing. I throw it all over the all over the counter, and then I just have this mess, and it's clutter. I don't know if you're like this too, or maybe your office is like this, where it's just kind of messy. But clutter isn't something that just doesn't look good. It actually affects our brain, our mental health, our stress levels, which we'll talk about a little bit later too. So would you rather come into a kitchen that looked like the picture here on the left, nice and neat and organized, or the one on the right where it looks like a bomb went off? I know which one that I would prefer to work in. Clutter is something that maybe we don't think about consciously, but it really does affect our stress. It raises our cortisol levels. It affects our mental health. But we need to think about this when we're in the operatory too. What can we do to reduce our clutter? What can we do to keep things organized? What would you rather look at? This tray here on the left or the one that's nice and pretty on the right? Which one would allow for a more organized, lower stress mind and appointment? And what looks better to the patient? As much as we hate to admit it, our patients do notice these things and judge us on these things. And we've got patients that come into the office, and if our waiting room is a mess or if it's dirty, unfortunately, they're likely to remember that versus the really high quality dentistry that we just gave them. So those are the things that we're focusing on tonight. And a lot of times people, when they think of ergonomics, they think of just posture, and that's definitely a part of it. But all of this organization and keeping things clutter-free, that is part of ergonomics as well, because it affects our efficiency. So from messiness to organization to how our operatory is laid out, it really matters to us and our patients. So that's what we're talking about today. We're going to talk about the pros and cons for the most commonly used operatory layouts. We'll also talk about how ergonomics does relate to efficiency and helps improve our patient flow and how we feel at work. We're also going to talk about how equipment is now being redesigned for women. If you think about it, the majority of dental workers in dental practices are women, and we need to start making sure that our equipment fits women. So we'll talk about that. And then we'll talk about how small changes can really have big payouts when it comes to organization. And when you think about organization or even improving your operatory, you don't need to drop thousands of dollars to do this. Okay, you definitely can if you want to, but there's also small changes that we can make that can really improve those things. I do have some handouts today. So if you're on a computer, you can go ahead and scan this QR code. You will get a PDF of all of the slides from tonight, or you can check the classroom area, and there's going to be a link there that you can click as well. But if you happen to have problems with this or you don't get the link, please reach out to me after the presentation and I'll be sure that you get that. So I'm going to go ahead and move on. And just a little bit about me. My name is Stephanie Botts. I am a dental hygienist. I've been practicing for a bit, over 17 years now. And I do still practice. It is on a part-time basis now because of my business. But I talk a lot about ergonomics. I created an ergonomic coaching business to help dental clinicians. And I won't go too far into my story because we just don't have time, but I started to learn ergonomics because of my own issues in the operatory with pain. I definitely was not always ergonomic, but my experience with ergonomics and pain and realizing how effective ergonomics can be inspired me to create my business, which is called Polished Posture. So I help dental clinicians with their ergonomics. I create a lot of content also for social media and other platforms. I try to put out as much free content as I can to help people with ergonomics. And then I do a lot of lecturing like what we're doing tonight. First off, what is ergonomics? Ergonomics is trying to make the workplace fit the worker. Okay, so whatever we are working with in our operatory, whether it's our patient chair or our patient or our stool or our operatory layout or where things are organized, all of that should be adjusted to fit us in something called neutral posture. If you don't know what that is, I'll talk about that in a little bit. But if we want to be more ergonomic, it does help us reduce our injury, but it also helps with office efficiency, patient flow, everything. So it really can make or break your practice. But what do we usually do when we go into our operatory? We usually fit ourselves to the equipment, right? We've got things laid out a certain way, and then we start reaching and twisting and contorting our bodies to fit our environment. What we really need to do is flip that around and start with us and make our equipment and our environment fit us, hopefully in neutral posture. The goal of ergonomics is to prevent injury. Now, I don't have time to go into all of this tonight. I do go into all of this in my longer ergonomic lectures, but we want to reduce our risk of injury because we in dentistry are prone to things like poor posture, our jobs can be highly repetitive, or we have the overuse and underuse of certain muscles. All of those things put us at risk for developing an ergonomic injury. A lot of people ask me, like, what's the one thing they need to learn about ergonomics, or what's the one product they need to get? And I wish I could tell you, just go get this one stool, or go get this pair of loops, or go get this one operatory layout, whatever it is. It's not one thing that's going to solve everything for you. It's the mixture of using really good equipment and knowing how to use that equipment, but also making sure that your body habits are under control. I've done a lot of assessments at this point, and there's some clinicians who have invested in all of the good ergonomic equipment, but their ergonomics still aren't great because they're reaching a lot, or they're twisting, or they're leaning. So it does take both. What we're trying to do is reduce the risk of musculoskeletal disorders. These are MSDs. These are things like rotator cuff injury or low back injury or tendonitis. Those things are career enders for us in dentistry. And most often they are preventable, but we have to have at least a basic understanding of ergonomics. And musculoskeletal disorders are tricky because they're not an acute onset injury. It's not like something quick that happens. Usually it's a really slow roll. That's how it happened with me. My first decade of practice, I really didn't have a whole lot of pain, but after that 10-year mark, it just hit me like a ton of bricks. And that's because of the gradual process of a musculoskeletal disorder. I can't go into all of that tonight. Again, I talk about that in my longer lectures, but just know this is something that typically grows silently, and it happens over time. And once we become symptomatic, like with pain or reduced range of motion, usually that disease process has been around for a while. But no matter what position someone holds in dentistry, if they're an assistant, a dental hygienist, a dentist, unfortunately, most people are in pain. So we've got this study here on the upper left. This was looking at dental assistants, and almost 100% of them reported pain. And then we have 84% of dentists report pain, and 91% of hygienists said that they either had suffered or were suffering from a musculoskeletal disorder. These pain rates are way too high, in my opinion. And I think it's because we haven't done a great job at really prioritizing ergonomics, especially early in our career. Not that it's too late to learn if you've been practicing for a while, but it's definitely best to learn this as soon as possible. But a lot of times pain and this injury can be traced back to how we're using our operatory and how things are organized. Another thing that's really been on my mind lately is the fact that most dental clinicians are women. If you've worked in dentistry for a while, I mean, I've worked in a lot of different offices, and every single office, it's primarily women. So we've got most hygienists are female, most assistants are female, and now we have increasingly higher numbers of dentists who are female, with over half of the dental students now being female. So if we look at the average height of a female, which is 5'3" to 5'4", just keep that in mind. We'll talk about that a little bit later. But historically, dental equipment and cabinetry has been based off the measurements of men. The average height of a man is 5'9". So if we look at a 5'9" male and a 5'3" female, that's a big difference. And if we've got equipment that's based off of those men's measurements, we're going to see women doing things like this, reaching deep into these cabinets, high into these cabinets, which really isn't good for us. So thankfully, companies like Midmark are taking this into consideration and are redesigning their equipment and their cabinetry to better fit who's actually using the equipment, which is women. There's several risk factors that we're going to touch on tonight. Just know that there's more risk factors than this when it comes to ergonomic injury, but these are the things that we're going to hit tonight. So we're going to talk about posture, repetition, and then how poor operatory design or inefficient operatory design really can affect us. Everything I teach and everything that I recommend, whether it's on a social media post or in my CE lectures or with my clients, comes back to this foundation of neutral posture. If we learn what neutral posture is and what it feels like, we can start to organize our day and our equipment and our patient so that we can ideally maintain neutral posture. A really good way to see if you're in neutral posture or not is to think of yourself in the profile view. And I call this my yardstick rule. So starting from the top, we want the ear vertically stacked on top of the shoulder. Most of us in dentistry, we're used to having our head forward because we're hunched over our patients. So we need to move our head horizontally back and up to get the ear vertically stacked on top of the shoulder. Moving down, that should be in line with the hip, and then that should be in line with the foot. So if you were standing up, I should be able to come and put a yardstick up next to you, and it would hit your ear, shoulder, hip, and foot all at the same time. Neutral posture is the position of the body where we have the most stability with the least amount of muscle engagement. And if you've heard of the term stack your bones, that's what this is talking about. We want our skeleton to be holding us up. Our bones are nice and thick and hard, and they don't fatigue like our soft tissue does, okay? You can do this seated as well. But if I was standing in neutral posture, I'd be able to hold that position for a long time and not get tired because my bones are holding me up. What happens, though, in dentistry is we break neutral, like we're out in the chicken wing, or we've got our head forward, or we're twisting. That takes away the power of the skeleton, and it forces our soft tissue to try to hold us up in these really weird positions, which isn't what that system, the soft tissue, is meant for. And that's why we get so injured in dentistry. So this is something just to keep in mind during your day. Even when you're with your patients, just try to readjust yourself and get back into neutral posture, even if it falls apart after for a couple of minutes, just try to keep reestablishing neutral posture and develop that habit. Seated, we want to try to maintain neutral as much as we can. And I know this isn't a lecture on patient positioning or clock positions, but those do come into play when we're talking about neutral. The operatory layout as well, and your organization and where you place your instruments, all of that should hopefully be adjusted so that you can maintain neutral posture. And just a quick tip, I generally recommend people trying to prioritize practicing from 12 o'clock. This will come into play when we talk about op layout. You can't do everything from 12, but we want to try to prioritize that. And then if you're off to the side, like what's shown there in the picture, you want to try to make sure that you're squared up there at the side of the patient and you're not twisting or leaning. But if we look at ways that we don't practice in neutral posture, we're reaching, we're twisting, we're leaning, all of that is not neutral. And these are some of the things that I see most commonly during my assessments. And really, the fix for this usually is so simple, but we get used to practicing a certain way, developing these habits, and maybe we know that they're not good, but that becomes somewhat normal to us, right? So it's like, yeah, I know this twisting and reaching isn't good, but that's just kind of what I do, so I'm going to do it. Same with our where our supplies are or our instruments. We're used to having them in a certain spot. Maybe we know there's probably a better way, but we're just so busy and we're focused on the patient that we just don't think about it. But it's the accumulation of the damage of these tiny little movements that seem pretty innocent, but it's just the accumulation over time, almost like a radiation exposure. A little bit is okay, but man, after 20 or 30 years, that really adds up. And it's the same with these injuries. It's kind of like death by 1,000 cuts type of thing. Reaching is one of the most common things that I see. And when we have the placement of our bracket table or our instruments that isn't in the right spot, it is going to force us into awkward postures or reaching. And just think about the time as well. I don't know about you, but when I'm seeing patients, literally every second, every minute matters. And if you're reaching constantly, doing this fully extended reach of the arm, like what's shown here, that is a literal waste of time and energy. At the end of the day, those seconds will add up, and that adds up to a lot of time. We are going to have to reach for things, obviously, but just a quick tip is you want to keep your most frequently used things really close to you. So it's a nice, easy reach. What we want to avoid is this fully extension of the arm, especially when the arm is reaching across your body. But these little movements add up to real problems over time. And it's these things that we don't really even think about, how we're racking the handpiece, how we're hunching over our patient, maybe we're twisting to get our instruments. So what we need to do, and I know what happens when we get involved with our patient and the appointment, is we completely forget about ourselves, which makes us really good caretakers, right, and dental clinicians, but we're not prioritizing our ergonomics there with the patient. What we need to do is set ourselves up first for success before we start becoming so hyper-focused on our patient. Before we go into operatory layouts, I do want to talk about some things in the op first. But when we talk about operatory layouts, Midmark has some really nice ones that focus on ergonomics. And that's why I've chosen to partner with Midmark, because they really do prioritize ergonomics. I'm going to go over just some basics of the most commonly used operatory layouts. Know that there's more out there. There's some that even, are just kind of piecemealed together. That's not necessarily what I'm talking about tonight. But there's pros and cons to each design that I'm talking about tonight. But let's talk about a couple other things first. So we've got patient chairs. There are some do's and don'ts when we're talking about patient chairs. Some really good things about these chairs, these are chairs from Midmark, is they have an adjustable headrest. I'll talk more about that in a second, but these adjustable headrests, not just headrests that pull in and out, but the headrests that you can adjust the angle, that can really help with occlusal plane placement when it comes to patient positioning. And then they have a really thin backrest, which is what I like. These thicker, cushy backrests might be nice for the patient, but that can be really hard for us to work on. If you think of the vertical height of the patient, if they're on a really thick backrest, that's going to lift the patient up by a couple or a few inches, right? But those are inches that we need. It's almost like encroaching onto our space. We want to make sure that that backrest is nice and thin. Something else I like is a narrow backrest. We want the backrest to be tapered as it goes up towards the head of the patient because our legs need to fit in there. If we've got a really thick, bulky backrest, like this one here, that's going to be really difficult to work on. This was actually a practice I used to work in, and the doc was super excited because he got this new chair. And I was like, oh my God, please don't put that in my operatory. And this was even before I knew much about ergonomics, but I could tell that was going to be a really hard chair to work around. Very thick. You can see from the side how thick it is. And those wings from the back, I mean, just imagine how hard that's going to be for you to get close to the patient when those things are in the way. So maybe it's good for the patient, maybe it's comfortable for them, but the less stuff you have in the way between you and your patient is going to be better for you. And then these adjustable headrests. I know this isn't a lecture on patient positioning, but I do want to give you a tip. I know me as a hygienist, I have struggled for 17 years with patients who say that they can't lean back in the chair, they don't want to lean back. I think that's probably because of fear, but also if their head isn't supported correctly from the get-go, and then we start to tip them back, that can be pretty scary for them and straining for their neck, okay? So a tip for you is when the patient sits down, wherever their head naturally is, you can kind of tell when you're looking at them, bring that headrest up to support their head so that when you tip them back, their head's going to be supported, their neck isn't going to be strained. Sometimes cushions can help too, but this will really help with patient compliance. But what I like about these mid-mark headrests is if you look at that one there on the left, it has a nice contour to it. So it kind of cups the patient's head so that they can't be squirming around too much. Plus it makes them more comfortable as well. But we want to think about the layout of the operatory, and it is not one size fits all. Layout matters because, like I mentioned before, I do prefer clinicians to try to prioritize working from 12 o'clock. Depending on the operatory you're in, sometimes this is difficult, if not impossible. If you see this picture on the right, this was a clinic I did some work with last year. They had really small operatories and everything was there at 12 o'clock. This is an example of a rear delivery system. There was no way that the clinician could fit there at 12 o'clock. It just was not possible. So they were forced to work from the side, which can be pretty straining for them. We also want to make sure the materials are organized and easily accessed, either by the hygienist or if it's a dentist and assistant between the two of them. You also want to make sure that there's freedom of movement all the way around the patient chair and in the operatory. And like the picture here on the right, there was no freedom of movement behind the patient. But again, all of this is to try to maintain neutral posture. We also want to think of how is that op going to be used? Like I said, it's not cookie cutter. Is the op going to be used for hygiene? Is there going to be one operator in there? Or is it going to be used for four-handed dentistry where there's two clinicians? There's some operatory layouts that are better for those than others, which we'll talk about in a second. Some common mistakes I see, though, is, again, no room at 12 o'clock. Sometimes it's interesting. So I worked for this clinic that these pictures are of the same clinic. And on one side of the clinic, they had super tiny ops, which was really hard for the clinicians to have access to everything that they need, where we see the reaching, like what's shown here. But then on the other side of the clinic, they had these humongous operatories. This is a picture of it on the right side, these huge ops, but then they had these huge back tables that took up all the space at 12 o'clock. And they kind of had the same issue as the small one because they couldn't access 12 o'clock. And then we have organizational issues causing reaching and leaning and excessive bending as well. This graphic is from Midmark, and again, they really prioritize ergonomics. What's recommended is for an operatory to have a dual entry from the back. So especially if it's a restorative op, you want the dentist to come in on one side, the assistant to come in on the other, so they're not tripping over each other or tripping over the hoses trying to get to each side of the chair. You also want to make sure that there is enough room from the back of the patient head all the way to the back wall. Or excuse me, from the back of the headrest when it's reclined to whatever's in the rear of the operatory, whether it's a counter or a cabinet. I have a photo of that here in a second. On the sides, you also want to make sure that there's enough room on the side for clinicians to work, right? So they're not crowded, but you don't want it to be too big to where they're reaching for their things. And then you want about 10 feet from the back wall to the foot of the patient chair. So too narrow of a space, there's issues. Too big of a space, there's issues. But there's definitely a way to design operatories so that they enhance your ergonomics. But again, you want to think about how the operatory is going to be used. And you want to think about how the positioning will be for the clinicians and access as well. The whole idea behind op layout is to have good positioning and good access, not just throwing a bunch of equipment in there or counters in there or random IKEA cabinets. I've worked in an operatory like that. It was just literal like random tables from IKEA kind of thrown together. Very hard to work ergonomically in spaces like that. And again, thinking of how that operatory is going to be used, whether it's with one clinician or if there's going to be a team in there. Now, getting at 12 o'clock sometimes can be an issue. And this is what I meant earlier when you want about 27 inches between the back of the patient headrest when it's reclined and whatever counter or table is back there. I was working at this office and I just reclined the back of the patient chair and put my clipboard there. My clipboard is 13 inches long. Okay. You can tell it's barely even 12 inches between the back of the headrest and the counter. The clinician could not fit back there. I could barely even get my leg back there. There was no way they could work at 12 o'clock. But what we found and what I've noticed in operatories is a lot of times the patient chair is not bolted down to the floor. It's not fixed to the floor. So if you have a lot of room at the foot of the patient chair, like the picture there on the right, you can actually scoot that patient chair, even if it's a few inches towards the back wall. You just want to make sure that there's not any utility boxes in the way there that you don't want to push your chair into that. But if there's room and if you have access, you can grab a friend or two. These chairs are very heavy, so don't do it yourself. But you can physically push that chair to open up a few inches of space. Another thing is swiveling the patient chair, so rotating the chair to the side. A benefit of some of the mid-mark chairs, like what's shown here on the left, is they have these push buttons at the base of the patient chair. So you can just push the button with your foot, swivel the chair, even if it's just a few inches, and that's going to open up some space, like what's shown here in the picture on the right. So the primary operator can fit there at 12 o'clock, and there's room for the assistant as well. Now let's go into the most common operatory layouts. So we're going to talk about rear delivery, split delivery, and then over the patient. Rear delivery, this is a really common operatory layout that I see. And I've worked in these too. So some pros for this is it's small. It takes up less space than some of the other operatory layouts. So if you've got really small ops, this might be a good option for you. It's really good for true four-handed dentistry when you've got a dentist and an assistant doing dentistry together. Both clinicians can easily access the instruments. And so it's called rear delivery because everything is in the rear. So basically everything, the bracket table, where the handpiece is, the suction, the air water, all of that is located in the rear of the op. So if you have a dentist and an assistant working together, everything is right there between them. It's very easy for them to access everything and then to do instrument transport. It can, depending on the operatory, like what I just showed you, sometimes it can be difficult to access 12 o'clock. So you want to make sure that there's still enough room back there, or there's at least enough room so that when you rotate the patient chair, the clinician can get there at 12 o'clock. But the problem I have with this operatory layout is it's very difficult for a single clinician to use. Let's say a hygienist. If a hygienist is trying to do work in a rear delivery, they're prone to bending and leaning and twisting because if you think about it, I'm right-handed. So if I'm trying to be at 12 o'clock behind my patient chair and I'm right-handed, if all of my instruments and the air, water, and the suction is there on my left, what am I going to do? I'm going to be reaching across my body to get what I need. Okay, that's a reach and a twist. And I can tell you, I have heard from dozens of hygienists who work in rear delivery operatories, and it's very hard for them. There is a way to use it ergonomically, but it does take a little bit of training, and most of us don't get that when we start working at an office that has an op layout like this. So just keep that in mind. Not all operatory layouts are the same. Some are better than others for certain things, and we just have to be a little bit more mindful when we're designing operatories. Then we have split delivery. So this is where you've got, again, imagine me at 12 o'clock and I'm working on my patient. A split delivery, I would have a bracket table off to my right, like what's shown here on the picture on the bottom, or the one on the top, actually. I'd have a bracket table there on my right that has my air water, handpiece, and then my instruments. Then on my left, there's another delivery where I've got, there could be a surface there to put more instruments or supplies. And then usually the air water and the suction is there on my left. So I've got things on my right and things on my left. It's a lot more balanced that way. So I still have easy access to instruments. Typically, this one, you do have better access at 12 o'clock because things aren't taking up that space at 12 o'clock. And this operatory layout can be used for both single clinicians like a hygienist or dentist and assistant working together. So personally, this is my favorite operatory layout because it can be used for both. But that bracket table, if you have a bracket table, just a tip for you, you want to make sure that the height of the bracket table is at your elbow level. Usually this bracket table is up a bit too high so that people are reaching up just a little bit to either rack their air water or their handpiece, or they're reaching for their instruments. So just make sure that that bracket table is at your elbow level when you're in neutral. And then you want to make sure to keep it really close to you as you're moving around the patient so you're not having to reach for it. This design also is really easily switched between right and left-handed clinicians. That's a whole nother thing, is a lot of the operatories are really made for righties. So if you're a lefty, it can be difficult. But this operatory layout, you can easily switch between the two. A drawback of this one is it's a bit bigger. So it typically can't, I mean, it can, but it can be tricky to fit into these smaller operatories that we see. And then we have over the patient delivery. This isn't super common. It's also called continental delivery. It's not really common, but I did want to mention it because I have seen it out there. So this is where the bracket table with the instruments, the air water, the suction, the handpiece, all of that is in one piece, one unit that sits over the patient. Okay, so over the patient delivery. When used correctly, this can be nice because you have the instruments right there. You're not really having to reach. I really like that. One thing I like about this is the cords being elevated so they're not just all tangled up and, dragging on the floor. But the problem with this is most clinicians are not using it this way, and they're not comfortable having it directly over the patient. And it's designed, that's what it's designed for, is to be right over the patient. There's some patients, as you can imagine, that would not like this. They wouldn't be comfortable with it. But also if they move around in the chair and they bump it, that could affect your work. If they're fuller bodied or fuller chested, that's going to mean that it has to be placed higher, ideally, than you would ideally have it, which then kind of takes away the ergonomic benefit. But a lot of times I see clinicians having this almost like that split delivery. So it's off to the side, which is not what it's designed for. And then they're having to reach and really pull on those cords. Another issue is the tension in the cords. It has to be set just right. And sometimes I've noticed that the tension is set way too tight. So the clinician is literally having to yank on those in order to use them, which again, takes away the ergonomic benefit. Mobile workstations are something that I really like to recommend to people, especially if they're in, let's say, a rear delivery operatory design, because it gives you another surface to put your stuff on. I really like these mobile workstations for like the ultrasonic or a laser for a hygienist. You could put a scanner on there, depending on what kind of scanner you're using. But these are really nice. They're portable. Obviously, they can go into different operatories. They're really good for smaller operatories where you just need a little bit more space. And if you're using it correctly, it really can provide another work surface for you, which would reduce reaching and twisting like what we see in the rear delivery system. But let's get back to, we're going to talk a little bit about cabinetry. So we really do need to think about who is using our equipment, which most often is women. Most dental clinicians, and as the years go by, because we're seeing more and more dentists, dental students are female, the majority of our workforce will be female. And if you think about it, the majority of our workforce is also in pain. And this is something that I've been thinking about lately is, are these pain rates that we're seeing in dentistry, are they related to the fact that equipment historically has not been made for the people actually using it? I know there's other issues too, but I do think that there's a contributing factor there. We really want to try to prevent reaching, leaning, and twisting for our dental workers. And most of you know that we do have a workforce shortage right now. So our teams are really even more valuable than they ever have been. And we want to make sure that we're taking care of them, that we're not hurting them, and that we have equipment really that is working for them. I have never thought as much about cabinetry as I have now that I work in ergonomics, but this is a big deal for us. Again, most dental clinicians today are female. However, the cabinetry and storage solutions that we have is not designed for them or hasn't been historically. We need to think about, and just remember, the average height of a female is 5'3" to 5'4". So if you look at this picture here on the left, we're just going to talk about how a woman interacts with the cabinetry. So this is demonstrating a traditional floor-mounted cabinet that's 24 feet deep. Okay, so 2 feet deep. This green zone is the primary reach zone. So that's where she can easily reach. She's not having to like really reach her arm across or really contort her body, but she's only able to access about 27% of that work surface. So that's not very much. And then the yellow there represents an extended reach. So that's when she's going to have to lean or reach about 25 degrees beyond the safe zone. And then the red area is anything that's really beyond her reach. So she's either going to have to get up on her tippy toes or get up on a step stool or get down on her hands and knees to access some of that cabinetry. The issue with some of these really, really tall cabinets too, is they're just not being used, like what you see there in the photo on the right. And that's not, I mean, we need all the space we can get, but some of these things are just literally not accessible, so people aren't using them. But we also want to think of visibility. If you look at the cartoon graphic there on the right, if you've had this experience, let's say you're in the operatory and you realize you forgot something and you think that maybe it's in that like second shelf there in the back, and you start rooting around, you're up on your tippy toes, rooting around, you can't see back there, then you have to go get the step stool, get up on the step stool, look into the cabinet, find what you need. Like that's a lot of reaching, a lot of movement, and a lot of time that is unnecessary. And she's just, because of the cabinetry, traditional cabinetry, she's not able to see in there. And this just leads to frustration and disorganization, and it's really not efficient. So we've got the upper storage, which is just too high for us. We can't see. Maybe we're not even using some of it, like I mentioned. And then the lower storage, where it's just too low. The cabinets are way too deep, so I'm having to really reach back there. Something else I've noticed too is we've got drawers that maybe there's a couple drawers that are positioned in a good spot, and so we're literally trying to cram everything into those drawers because it's convenient, or we're just like front loading the drawers. We're just not making efficient use of the space that we have. And I mentioned earlier when I was talking about my kitchen about clutter. This is a big factor, and our brains are wired to see order or to make order of things. So if there's clutter around, our brain is subconsciously trying to process that and make sense of it, even if we're not actively looking at it. But all of that leads to increase in cortisol, which increases our stress, makes us tired, it increases our anxiety, and it can actually affect our sleep at night. And I think all of us can agree we all want to sleep better, but who would have thought that maybe a messy tray or a messy operatory can actually affect our sleep at night? But that's what science is showing. And I think of clutter too, or I think not just clutter, but like our brain trying to process things in the background. It's almost like a background app running on our computer that's slowly draining our battery. I've noticed that when I'm trying to sit and relax and watch TV, or even if I'm being social with people and my phone is right there, I'm still kind of looking over at my phone and thinking about, like, am I missing any texts? Am I missing any emails? Am I missing any notifications? It makes it really hard to relax or to stay present in what you're doing. And that's kind of what clutter does too. So even if you're not actively looking at the mess, your brain is still processing it. Cluttered operatories work the same way, or a sterilization area. Our brain is still trying to make sense of all of that mess, and it really just leads to a lot of fatigue and distraction and doesn't make us our best self. So there is a better way to just organize things a little bit, and it just not only helps our day, but it helps our mental health as well. But this lack of organization that we see equals a complete waste of time. And it doesn't look good to the patient either. If we have to get up and run and get something constantly, or if we're rooting around our drawers in our operatory trying to find something. It also affects our restocking system. If we don't have a good restocking system or inventory system, maybe we're spending a lot of money on unnecessary supplies that we don't need. We're constantly buying sealant material when we've got plenty of sealant material. It's just in the wrong drawer, or it's in the back of the drawer, but we can't see it. So it just leads to wasted time and frustration and stress, and a waste of money as well. Oops, sorry. But if we want to look at solutions, instead of those floor-mounted cabinets that I mentioned earlier, Midmark has some really nice wall-hung cabinets. So this brings down the top of the upper cabinet, and that brings up the lower cabinet. So we're more in that healthy reach zone than the reach zones that I showed earlier. When the cabinetry is too tall or too deep, it limits access to our storage, and it can contribute to stress injuries or just stress in our brain. But these wall hung cabinets bring the upper part lower and the lower part higher, so that it's more convenient for us. If you remember back a few slides, the average female was only able to access about 27% of that standard cabinetry. But with this one, that number goes up about 170%. So a lot higher access, and the visibility is a lot better too. Something else Midmark has is something called flow shelves. So these instead of these shelves being horizontal, which makes it hard for us to see what's back there, especially if the cabinet is high, there's a 15-degree slant on these shelves. So it slants down, and then combined with these bins where really we can see everything that's in there. We can access things a lot easier. So it limits our reaching, and it limits the time that we're like spending trying to look in these blind zones. Another benefit that Midmark has is they have designed these modular cabinetry systems. So I think of this as, if you've ever seen those modular couches where you've got these little cubes that you can organize in different ways to make it work for you. That's kind of how I think about it with these cabinetry as well. So it's a mobile cabinetry system. So you've got all these drawers that you can organize everything. Also, if you just put in some drawer organizers, which we're going to talk about on the next slide, that's going to take it next level for you. But it's also adds another work surface. So depending on what operatory layout you have, or what clinicians are working in that operatory, you can move this mobile cabinetry around to fit you and fit what you need. You can move it in between operatories, or move it around the op depending on what you've got going on. And it's highly adjustable based on the clinician and the procedure. And I mentioned at the beginning too, you don't have to spend thousands of dollars to improve your organization. I mean, if you want to do a complete operatory overhaul, Midmark is great for that, but they've got these quick fixes too, which really doesn't cost a whole lot. You have these drawer organizers, like I mentioned earlier. I can think of this drawer in the clinic that I work in right now. It's like everything is in there, and it's not organized in the best way. So we're all like having to root around trying to find what we need. But these drawer organizers are a really nice solution, and it maximizes the space you have in your drawer. They also have those flow shelves and bins, which can help organize your cabinetry. And all of this just improves your ergonomics, reduces the reaching, increases your efficiency and your patient flow as well. And what's nice about these, the flow shelves and the bins, is they can be fit into any existing cabinetry that you already have. They're available in in all widths for your cabinets, so they can be retrofit into what you have. But when we think about ergonomics, it's not just about posture. Posture is an important part of it, but we want to think about efficiency too. So we can increase our patient flow, perhaps even increase production. But when we're thinking about that, we don't want to put any more physical demands on our teams, because our teams are our most valuable resource. They're really valuable right now because they're really hard to find. So we don't want to put them at risk for burnout or put them at risk for injury. We just want to provide a safe, less tiring, enjoyable, organized work environment that hopefully is free of clutter as well. And we want to think about the patient perspective too. We want to make sure that they've got nice things to look at, there's not mess everywhere, and their appointments are nice and efficient without us moving around, running around trying to find things that we need. All right, so that is the end of the presentation. Thank you so much for joining tonight. I want to thank Midmark again for sponsoring this webinar. I'm going to go ahead and jump into the Q&A box. And if I happen to not get to any questions, just please reach out to me, this QR code. You can scan it, you can hit me up on my website, and I'm more than happy to help you. Okay, so I'm just looking at the Q&A. Just give me a second. So I have a question about a pediatric dentist, how to improve ergonomics when working with kids, because kids are moving around a lot and can't stay still in certain positions. Yes, I totally agree. I wonder if you are using regular patient chairs or if you're using a bench, but something I've really recommend when working with kids is using cushions. There's different, there's like booster cushions, different positioning cushions. One that can help them be more comfortable, but also it kind of holds them in place. If you think about these benches or these big patient chairs, the little bodies of kids, just there's a lot of real estate for them to be moving around in. So in my longer ergonomic CEs that I give, I do talk about positioning for kids, but I guess short answer is using cushions can really help you. And I'm reading the second question. Hang on. I have a question about a older chair that does swivel, but the brake that locks the chair tends to give out. So I would, if it's a Midmark chair, I would reach out to Midmark to see if there's a fix for this. If there's maybe just a part that can be swapped out, I'm honestly not sure. But I would reach out to the manufacturer of that chair to see if there's something that they can do. And how often do I recommend standing? I do recommend, I would love it if clinicians could do like a 50-50 split between sitting and standing. Standing is really nice for us because it improves blood flow. Like if you see standing desks that people recommend for office workers, there's a reason for that. Okay. Our body is meant to move around. The more we move, the better, and it increases blood flow. So me personally, I'm clumsy. And so if I stand and try to use the foot pedal at the same time, I feel really off balance and it's just not good. So what I recommend is sitting for things that you need the foot pedal for, and then trying to stand for other things. What's really nice, like Midmark has these chairs that go up really high, because I know for some clinicians, especially if they're on the taller side, like 6 feet tall or higher, some of these patient chairs will not go up high enough for them. So that's a benefit of the Midmark chairs. But you could stand for things like doing injections or hand scaling or scanning or flossing, like things that you don't need the foot pedal for, and standing is a really good option. The tips for rear delivery I mentioned, Rear delivery is great for true four-handed dentistry. If there's a single clinician working in a rear delivery operatory, it can be difficult, but there are ways to use it more ergonomically. And I mentioned earlier, or I forgot to mention earlier, I actually have a rear delivery YouTube video, if you want to search for that, that has some tips on how you can use that better if you're working in there alone. And to purchase the drawer organizers, I would reach out to Midmark as far as how to purchase those. And do I prefer a specific operator chair? Yeah, I talk about operator seating in my different CE. It does depend on the clinician. I am partial, though, personally, to a saddle type stool. I like those for most dental clinicians. But if someone can't tolerate a saddle stool or doesn't like it, Midmark actually has some really nice traditional operator stools. Some of the older stools from other manufacturers I'm not a huge fan of, but Midmark does have some nice ones. But things to think about when you're sitting on your operator stool is you want to make sure that your hips are at least slightly above your knees, if not way above your knees, so that your thighs are sloping downwards towards the floor. That might be different than how you were taught in school. I know it's different than how I was taught. I was taught to have a 90-degree angle between my torso and my legs, but we know now that's not the best way to sit. So depending on, it doesn't matter if you're on a regular stool or a saddle type stool, try to have the height high enough so that your hips are above your knees. How to deal with patients who don't want to lean back too far. I would love to know if you're a hygienist, an assistant, or a dentist, because it's kind of a running joke in hygiene that like patients don't lean back for us, but they always will for dentists. However, when I lecture to dentists, they say they have the same problem. So I actually have a bunch of tips. On my Instagram, I literally just posted a video or a post about this today, if you want to check that out. But for patients who don't want to lean back the chair, using cushions can really help. If you have a patient that cannot lean back because of medical reasons, I recommend standing. That's just going to give you a little bit more play. But doing things like trying to compromise with the patient, telling them that you'll give them some breaks, starting with the lower arch if you can, because you can actually treat the lower arch with them partially reclined pretty comfortably. And then just letting them know if you need to work on the upper arch, just say, I need to tip you back 2 or 3 more inches for X amount of minutes. Usually when they're already partially reclined, and they're used to that, you can tip them back a little bit more and they'll be okay. I think it's just the shock of going from fully upright to all the way into that full supine position that can be tough on some patients. I have a question about an office that has benches in their treatment room for pediatrics. The dentist bought a saddle seat for himself but doesn't use it. Is it okay for an assistant to use it? I would, check it and see if you think that it's a good fit for you. Stools do depend, they're kind of body specific and size specific. So a stool that fits, let's just say a 6 foot tall man, I don't know if it would fit, for example, a 5'3" female, but I'm happy if you want to like send me some photos or reach out to me. I'm happy to help you. I'm not sure if that chair would be a good fit for you or not. Flossing tips. I actually have a video on my Instagram about flossing as well. I recommend doing it from 12 o'clock and standing. A lot of hygienists or dentists do, or assistants, they have problems with chicken wing when they're flossing. If you stand up, I guarantee you that chicken wing is going to be a lot reduced, if not completely reduced. But check out that video. If supplies are located in the bottom drawer, is it okay to bend when sitting? Honestly, what I do, like I said earlier, movement is our friend. And so if you need to get something at the bottom, I would get off your stool and do a little squat and get down into that bottom drawer. Leaning over when you're seated puts a lot of strain on your back and it really tightens up the hip. So I wouldn't recommend that. Bending, like I said earlier, it's like death by 1,000 cuts, right? So if you're just doing like one bend or two, it's probably fine. But what we want to avoid is just doing this habit where it turns into like 10, 20, 30 bends over the span of a day. That's going to be problematic for you. All right. So I think I actually, yeah, I think I got all the questions. So thank you everyone so much and have a great night. And please reach out to me if I can ever help you.